which will go into effect October 1st of 2014. Just a second, we're trying to advance the. Okay, ICD-10 will be effective October 1st of 2014. Well, I realize that some physician offices may be farther along in their preparedness than others. We're going to talk just basics on how to prepare, so some of the information that's provided today may have to be modified based on the size of your practice. ICD-10 was developed by the National Center for Health Statistics as a clinical modification to ICD-10. Basically, in a nutshell, we are moving to ICD-10 because we are the only industrialized nation that hasn't implemented it, and ICD-9 has not allowed us to expand to the numbers of codes to the specificity that they have wanted, and that is why we are moving to ICD-10. Claims will not be processed prior to October 1st of 2014 with ICD-10. So up until October 1st of 2014, you will continue to need to code with ICD-9. The codes will be updated annually, and as in the past, physicians will continue to use CPT codes to report both inpatient and outpatient procedures. That will not change. Only the diagnosis coding will change from ICD-9 to ICD-10. In order to prepare for the transition, it is very important that within your practice you determine where you're at for preparedness. It is suggested that you select a team leader, a person who knows coding, the electronic record, or your paper document, the departments to be involved. The team leader is the one that will coordinate with all departments and vendors with regard to assessments and implementation for ICD-10 to see where you're at in terms of readiness. The team leader will also act as a contact person for all outside communication with third-party agencies, outside vendors, and document such contacts. The team leader is not responsible for physically completing all the assessments for the systems, but rather coordinate with your staff and vendors to get them done to determine where you're at in terms of the readiness process. This slide shows the departments and systems within your practice that will need to be assessed for ICD-10 readiness. Your health information management or electronic health record, your encoding software or any code lookup software that you might have, billing software, your registration, pharmacy if applicable, your lab if applicable, radiology, and also your practice management system. If there are other systems within the practice that will be impacted, you need to identify and assess these as well and add them to the list. Lab and radiology will be affected because the ordering physician will now have to provide a diagnosis and reason for the test, which you have had to do in the past, but because of the specificity now in ICD-10, the diagnosis or reason for these tests will have to be documented with specificity as outlined in the ICD-10 book, so that the physicians will have to know how to access that. ICD-10 requires more specificity, as we'll talk about a little bit later, especially in orthopedics. So the physicians and the staff in this area will have to really know what the changes are. Your software assessment, any software that you have within your practice will have to have the ability to continue to support the ICD-9 codes for transmittal up until October 1st of 2014, but also for historical data. And it will have to have the ability to support the ICD-10 codes. ICD-9 codes were up to 5 digits. They could be alpha numeric or straight numeric. ICD-10 codes are they're up to 7 characters in length, and they are all alphanumeric. The descriptions in ICD-10 are a lot longer and more specific, so the software will need to allow the facility to change the terminology that can be understood understood by those who access the codes, such as the providers. It's a lot more detailed, as you will see in a little while. You also need to find out how many codes that your software system can accommodate. Your software has to be 5010 compliant for electronic transmissions. The encoder or the lookup software must be updated to support the ICD-10 codes and the descriptions. Any transcription software templates that you have for an electronic record will have to be updated with new templates to accommodate the specificity now required for ICD-10 code assignment. And the mapping or the GEMs, which you probably hear a lot about, that you can map a code, one code to another, those were developed for insurance companies. And while a lot of software will match, if it's a one-on-one match, there are many codes that are not a one-on-one match, and it will give you the ICD-9 code and then the options for coding under ICD-10. As you see here, in ICD-9, hypertension is code 401.9. It is a one-on-one match for ICD-10, which is I-10. But for pregnancy, you will see in ICD-9 that spotting complications during pregnancy is one code, 64951, but when you go to code in ICD-10, pregnancy codes will be coded based on trimester. So this one code in ICD-9 has 3 possibilities under ICD-10 based on trimester. So again, in documenting the trimester would have to be specifically recorded for each visit. Other diseases of the bone and cartilage under ICD-9, you will find there is a 1 to 2,530 match to ICD-10. So while the software, the mapping and the GEMs is great if it's a one-on-one, it's not going to give you the specific code if there are more options available. Again, any software that is used for ICD-9 right now will need to be updated to support all of the ICD-10 codes and the definitions. Okay, to get started, you need to identify the vendors, the payers, the software systems, your software providers, the clearinghouses, billing services, and any contracted coding services that you use within your practice. All of these entities must be ready to go for any claims, for all claims submitted for dates of service on or after 10/1 of 14. Come 10/1 of 14, it's like turning on the light switch. All claims with dates of service on or after October 1st of 2014 must be submitted using ICD-10 codes. So all of these outside vendors, payers, software vendors, billing services, coding services, they all need to be ready to go, knowing that those codes will go through the system. For each vendor that we talked about in the previous slide, we recommend that you make a list, outline the name of the company, the address, the contact person in charge of the ICD-10 implementation and transition for that vendor, the email address, the direct telephone number, and the fax number. This will allow you easy access to contact those people regarding ICD-10 conversion issues or preparation. A master log of this information listed here should be maintained by the team leader, because as we go through the process, you're going to need to be contacting people within these vendors to find out where they're at in terms of readiness for the implementation on October 1st. You need to determine from each contact person where they are at in terms of readiness for the actual ICD-10 implementation. We need to ask each vendor, service, payer, contact person identified, we need to know the month, day, and year they will actually be ready to implement ICD-10. We don't want that to be October 1st of 2014. We need to know ahead of time that they're ready to go. You need to also find out when they can give you a testing plan. We have determined that Blue Cross has started testing as of 11/1 of 13. There's information up there to send an email with your contact information to Blue Cross with regard to testing. Medicaid, we've been in contact with them. They plan to start testing in April of 2014. It's our understanding that UHC is now testing. Unfortunately, Medicare has no plans for testing whatsoever at any time, which is of a major concern. And we are all also under the impression at this point that the clearinghouses have not determined when they will start testing, and they are actually the farthest behind of anybody in terms of preparedness for ICD-10. So it's important that as we get closer to the dates that they'll allow testing, that the testing with payers actually take place with actual medical record documentation to make sure that it will go through. What we've been told is that testing with payers is typically done utilizing the GEMS, which are fake scenarios, and we want to know that claims using actual medical record documentation that has been coded using ICD-10 will go through the system. Some of the questions that you need to ask your current software vendor is, will a mapping or a crosswalk strategy be available between ICD-9 and ICD-10 code sets? You also need to find out specific dates, month, day, and year from them. What is the timeline for the system modifications to accommodate ICD-10? Again, we don't want to wait until September to have them tell you that they're just now starting for the system modifications. We need to know that by October 1st of 2014 they're ready to go. You also need to ask them specifically to document what the modifications include. It is important that you find out if the software vendor will continue to support the applications prior to ICD-10 modifications, or if they will discontinue or charge for products due to ICD-10 implementation. So you'll need to find out what, if anything, is going to be different. Are they charging more? Are they going to stop doing something, add something else? So you need to find out from your software vendors what is going to happen here with any changes as a result of ICD-10. You also need written assurance from these vendors or payers that the products and testing plans meet your specific needs. While it's nice to know that your clinic down the street is going to fly through, you want to make sure that your claims are going to go through the system effective October 1st. Again, you need to find out if the vendor is going to discontinue or charge for products due to ICD-10 implementation. Find out specifically what they are going to discontinue, if anything, and how you will be affected with your system to support both ICD-9 and ICD-10 codes. And again, ICD-10 is up to 7 digits alphanumeric, so the system has to be able to support those 7 codes in the alphanumeric manner. And will the systems allow you to modify the descriptions? As we get into ICD-10, you're going to find out that the descriptions are much longer and more detailed, so it's important that for you in the facility, in your practice using ICD-10, that you can modify those descriptions to make sense for the people that are using them. Also, the software, again, needs to be user-friendly for you, not for the people who programmed the system. Other questions for software vendors is, will the implementation for ICD-10 be phased in? If so, you want to know what the time frames are. And will they allow testing of actual claims prior to full implementation? If so, when and how can you participate? And will the vendor provide training to the new ICD-10 functionality? If so, where and what is the cost? The training needs to be conducted for your staff by vendor staff who know how to use the applications that you're going to actually use, which is the coding, billing, and reports. What has happened in the past with some of the transitions in the hospitals is that the training has occurred to the hospital staff by the people who develop the software. and they have no idea of how the hospital is using that software for coding, training, pulling reports, and that kind of thing. So it's important that all of the staff using the software be trained to know how to use the system within the software, the applications within the software that will be affecting them well in advance of the October 1st, 2014 deadline. If you're looking for a new software vendor, you might want to get started right now, because the sooner you decide and start implementing, the better. Some of the things that you need to take into consideration is how their product will simplify your transition to ICD-10. How does the functionality offered by your system compare with their system compare with your current system? Ask them how the functions are compared to your current system, and will the system require a conversion? If so, conversions are very tricky, so you will want to know the specifics for the conversion. What is the cost? What is the time frame for the conversion? How will the conversion take place? Who's going to be involved? And what are the maintenance costs? When you're converting from one software to another, there are going to be a lot of glitches and things that are going to have to be, you're going to have to go back and fix. So you want to make sure that the conversion, if there is one required, is done as soon as possible to get all of those issues resolved before you move into ICD-10 implementation. You also want to find out if their system will interface with other systems that you may not convert, if you have a pharmacy or if you're using a different billing software. And also, if you are moving to a new vendor or even your current vendor, ask them how they are going to provide help desk services, what the hours are, what the process is, and what the cost. You don't want to be in the middle of a busy clinic day, the system goes down, and you have no way to access the help desk people to get that up and running for you. So it's really important that if you don't have an on-site IT department, which many physician clinics do not, that you have assurances from them that they have people available to you should you have problems with your system during your working hours. Other new vendor considerations: who in the area is using the current system, and if there are practices similar to yours, I would get the names of those practices and contact them, go over, take a look, and see if they like it. Talk to actual users about it versus just taking the vendor's word for it that it works really well. You also need to find out what product guarantees they offer and what are the guarantees included in the contract price. Again, what is the time frame for implementation? Again, the training program is vital that it be conducted for your staff, for your type of practice, for the people that are going to access the application, so that they have a full understanding of how that software will work. What is the cost of the training program? Is it included in the purchase of the software? Are they going to come on site? Is it going to be via phone? All of those things need to be determined and written down so that you know what the expectation is. And again, I can't emphasize enough the importance of help desk. The other thing that we need to make sure to find out is what kind of testing will the vendor do and the time frame to assure all systems are a go prior to October 1st of 2014 ICD-10 implementation date. And you also need to find out from the vendor what a go-live date is. The actual testing to make sure the software works has to be done with actual claims in your facility. I've been working with a hospital, for example, who did a conversion to a new system for coding and billing, and they, while they thought testing had occurred, it did not, and the charges are now not posting correctly, and they are 4 months behind with coding and thus billing because the testing wasn't done to assure that the process works. So I can't emphasize enough the need to do in-house testing. It is vital that any clearinghouse billing or coding services that you may utilize provide proof to you that they will be prepared and ready to go on October 1st of 2014. Again, there is no grace period for submitting claims with ICD-10. On October 1st of 2014, all claims must be submitted using ICD-10. You need to determine by talking to the contact person that you identified when they are in the transition process. They need to verify that they are up to date with the version 5010 standards for time frame. They have to assure to you that effective with 10/1/14 dates of service, codes will go through with the new ICD-10 codes. You can also ask if your practice can be a test site. Ask if you can set up regular check-in meetings. If so, schedule date, times, and names of those who can attend. Ask if you can submit test claims. And again, these are claims of actual medical record documentation with the ICD-10 codes assigned to your patients to see if they'll go through the system. And then, as with any software vendors, any clearinghouses, billing, coding services that you utilize as a contracted service, you will need to find out if there will be a pricing change for any services due to ICD-10 implementation because of the specificity of learning the coding. There's going to be a lot of training costs for outside coding services and clearinghouses to get their software up to date. So be sure that you ask and have them put in writing any pricing changes that will be affected as of implementing ICD-10. There was a MGMA research done at the beginning of this year where 1,200 physician practices with more than 55,000 physicians responded. The average expense for a 10-physician practice to upgrade or replace their practice management software and the electronic record software to accommodate ICD-10 is $201,000, $690. More than 52% of the respondents have not heard from their practice management vendor regarding when software changes would be available to their practice. Nearly 50% had not heard from their electronic health record vendor. Almost 60% reported not having heard from their clearinghouse regarding a testing date. Only 8.6% have started or have completed testing with their major healthcare plans, and fully 70% had not heard from their major health plans. So it's really important that you know where you stand in terms of the transition for the payers and the vendors and the clearinghouses that you use. This next slide gives you an idea of where the responders were, how concerned they were about implementation. And as you can see, the cost is very much a big issue. Coding productivity, we're going to talk about in a little bit, is going to decline significantly, as will the money will come in very, very slow, and the training. So, and it's going to be very much more difficult to for providers themselves to actually do the coding, which we're going to talk about a little bit later. So this kind of gives you an idea. To prepare for ICD-10, you need to review within your practice how you use ICD-9 codes right now, and make a list of those areas where right now you are actually using ICD-9 codes. For example, your authorizations, your pre-certifications. Any ICD-9 codes that have pre-printed codes on the forms, of course, will have to be changed if you're going to be able to do that. Registration, physician orders, your medical records and your electronic health care record, your super bills and encounter forms. I know a lot of providers are used to using encounter forms with a pre-printed form, pre-printed diagnoses and ICD-9 codes. I have an example of an encounter form for a family practice that is 9 pages with very small print with ICD-9 code or ICD-10 codes and diagnoses. So ICD-10 codes are going to have to be assigned based on documentation. So it's uncertain as to whether or not the encounter forms, which providers have been accustomed to having the diagnosis and the code, will even be feasible. Billing systems, coding manuals and coding books. Even if you're using an electronic coding system, a coding software lookup system, it is our recommendation that you have the ICD-10 coding manuals, the ICD-10 coding manual for diagnosis coding in your practice, and that staff who assign codes know how to use the book. It's going to be very difficult for them to use the software lookup if they're unfamiliar with how to access the codes in the book. State required reports, any reports that you run will have to be looked at, and then again, other departments, lab, radiology, clinic, pharmacy, your HCFA 1500 forms. So again, we need to make sure that the billing systems are interfacing with your outside entities. And again, one of the biggest things that we need to do is to review the actual documentation in the records and any electronic templates to see if they will meet the new ICD-10 guidelines. And we're going to talk about some of the significant differences here in a little bit. You can also develop a list of the ICD-9, the top 10 ICD-9 codes that you have in your practice as a place to start for looking at documentation to see if it will meet the specificity outlined in ICD-10. You can begin to compare the description between ICD-9 and ICD-10. The ICD-10 books, some have been printed. You can order them now if you want. I know practices have gotten used to some of the specialized books where you could get coding for orthopedics or coding for physical therapy or what have you. Those books have not been printed as of yet, and I'm not sure that they will be. But the actual ICD-10 code books have been printed. There are 2 volumes. There is one for diagnoses, and there's one called PCS, and that is the PCS ICD-10 book is for procedure coding. You can buy those at any time. The codes will not change before the implementation date of October 1st of 2014. ICD-9 codes, we are told that there are not going to be any more changes or additions made to ICD-9 codes prior to 10/1 of 14. So if you have a current 2013 book right now, you will not need to order a new one for 2014. Those codes are not going to change. Again, documentation is going to be the key to assigning ICD-10 codes. You will need to order 2014 CPT books, however. Again, the use of CPT codes has not changed. You will still use CPT codes within your practice for the same things that you're using that for now, and there were some major changes to CPT codes that will go into effect January 1st. So be sure that you do order new CPT books for 2014. You need to determine who within your practice will need to be educated and what education are they going to need. It's vital that your practice staff for your coders and billers be educated, and your lab and x-ray people. Now, we don't expect these staff to actually go to ICD-10 training. Of course, your coders will need to do that, but the billers and the lab x-ray and other staff will just need to be aware of the changes to the ICD-10 system and how they are affected. Providers, the providers are going to have to be educated on the changes in the documentation guidelines required by ICD-10. Again, ICD-10 is it includes a lot more thousands of codes. The descriptions are longer. They are more specific. So the documentation is going to have to be specific to reflect this specificity. There are also questions that you will need to ask patients that may not be comfortable to them. For example, there is a code in ICD-10 now for an elderly patient who tries to save money by taking hypertensive medication every other day instead of every day, comes in for high blood pressure and is admitted. There are ICD-10 codes for underdosing and also to reflect that the patient intentionally underdosed due to financial hardship. So there are a lot more codes available for this, and so providers are going to have to be aware of what questions that they are going to need to ask patients to get the most specific information to provide that specific code. The documentation templates, if you have an electronic health record and you have documentation templates, those will need to be reviewed to make sure that that they can be revised to prompt you, if you will, to the things that you're going to have to document in ICD-10 to make it more specific. And you might also want to start educating your patients, questions that they will have to answer, and also to prepare them for the fact that they may be receiving denial letters after the implementation of ICD-10. We are anticipating denials based on just millions and millions of claims going through. So you might want to prepare them that they may be getting denial notices and how you want that to be handled if they do get a denial based on ICD-10 claims going through that didn't pass edits. So for education and training, again, it's a good idea if you can list by name or department who needs to be educated. What education do they need? Do they need education? Do they actually need to attend ICD training class to see that to learn how to assign the codes, or do they just need to learn how to use the updates to the billing system? So you need to identify who needs the training, what specific training they're going to need, and who's going to provide it, where will it be provided, and the cost. There are a lot of online information, so maybe that's something you can do, or maybe there'll be some other training provided by some other organizations. But whoever needs the training, you'll have to determine who that is, what training they're going to need, and how they're going to get it well before the October 1st of 2014 deadline to implement ICD-10. Okay, so here's where things are going to get kind of ugly. You need to make sure that you consider what's going to happen through the transition. Coding productivity with the implementation of ICD-10 will take a straight nosedive down. I can't be any clearer than that. I've been coding with ICD-9 for 25 plus years, so a lot of the codes, as I'm sure some of you, they're memorized, so I don't even have to look them up anymore. ICD-10 is completely different. There are no similarities. We've actually been told that people who have never coded before have a better chance of learning ICD-10 than those of us who have coded and have to now erase all these codes from our head. So coding productivity with the implementation of ICD-10 will decrease significantly because every diagnosis code that person has memorized for years and years, all of those will have to be looked up, either in the coding software or in the book. So coding productivity is going to decrease very significantly. That means that the days in AR are going to increase significantly. So when the coding drops, the claims aren't going out the door, so the money's not coming in as fast. All pending claims with dates of service prior to October 1st should be entered. Well, they have to be entered using ICD-9 codes, but if you can get those claims with dates of service prior to October 1st, 2014 entered and billed with ICD-9 prior to October 1st, then at least you've got that, you're caught up to that point, you've got that money coming in. But I can't tell you enough that it's going to be a huge change in productivity and the slow receipt of money. They are telling people that they should establish a line of credit for practices well in advance of 10/1 of 14. If, for example, there's major problems with the submission of claims, you'll want to be able to continue working, and you may need to have a line of credit. Again, it's very, very important to test the system, whether it be your current system that's been upgraded for implementation to ICD-10. If it's a new system, it's important that you track all electronic submissions for any claims submitted October 1st of 2014 and after. You need to keep a log of all of those from the date submitted through the date of payment. This will allow you to follow up any claims that have not been paid and resubmit if necessary. Identify and discuss with your practice what you are going to do in case of a payment disruption. There is definitely going to be an increase in denials. Conservatively, they're saying 10%. We think it's going to be higher. So there are going to be denials that you're going to get that you're going to have to rework and resubmit. So you want to keep track so you know what you've done along the way with all of those claims. Again, Medicare has indicated that they are not going to do testing. So that is of concern to see what's going to happen when all those claims go through. You need to look at your forms to do any revisions on requisition forms and counter forms or other documents that contain code numbers now in ICD-9 and determine how those diagnoses are going to be documented on the forms. Again, due to the specificity of the documentation, it may not be possible to put ICD-10 codes on your encounter forms because of the specificity whereby the codes are going to need to be assigned based on documentation. ABNs, make sure to use the correct language for your ABNs. And again, consider educating your families and patients with regard to implementing the new coding system, questions that they're going to be asked, and expected increase in denials and more specific and extensive information that you're going to have to ask. An example is if you have a patient that presents with a dog bite, there actually is a requirement based on the specificity of coding in ICD-10 that the size of the dog needs to be determined. So as we get into this, you're going to see the types of things that you're going to have to ask. Denials management, again, it is vital that you track all denials, and it's recommended that you prepare a spreadsheet either in Excel or however you want to track denials. I know some clearinghouses have denial management tools that might help you, but for any claims submitted on or after October 1st of 2014, you would want to document the patient name, date of service, their admission or claim number, third-party payer, the date of the denial, the reason, the date resubmitted, and each time you resubmit, document, and the date that payment's received. If you're also keeping a log like this, you may find a trend if it's a certain code that's not going through or something like that where you could easily fix that and resubmit those claims. Again, as part of a spreadsheet for denials, track any phone conversations that you have with your third-party payers. I can tell you that you call them up on the phone, you talk to one person one time and one person another time. If you don't document the date, the time, who you talked to, what you talked about, and document that, they are not going to remember who you are and what they said to you. So you want to protect yourself regarding any claims or anything that you're talking to them about, so that you can say, okay, I talked to Mary Smith on this date regarding this patient, this is what she said. And then you've got some backup documentation to go by. Again, we talked about spreadsheet for contacts, Medicare, any third party. Again, the date that you contacted them, how did you contact them, by phone or email, save your emails, the name of the person, what did you talk about, what was the outcome, and if there's a data follow-up scheduled, document that. And please do maintain copies of any emails and of all your spreadsheets, so that you know where you're at when you're talking to people about this. Because just remember, on 10/1 of 14, anybody in the whole entire United States who submits claims will have to submit with ICD-10. So I don't know how many millions of claims that's going to be each and every day. It's going to be a lot. So you need to budget for the transition. You need to budget for your references, any training costs that you're going to have to pay for, your software, either new or updates, the slow rate of payment after 10/1 of 14, and any denials and resubmissions. So those are the things that you have to take into account when you're budgeting for the transition to ICD-10 if you have not done so already. Again, if you want to list the top 10 diagnoses in your practice and research the documentation requirements. If you don't have a book, I didn't mention on the one slide, you can go to, if you go back to slide page 21, I think it's the ICD-10 Preparedness, develop a list of ICD-9 codes. Okay, you will see up here that you can access the ICD-10 codes and the descriptions at cms.gov. It's a pretty lengthy document, but if you don't have a code book right now and you want to at least start looking at some of these, the codes and the descriptions, you can access it free at cms.gov. So again, you can list the top 10 and research how the documentation requirements are going to change. You can begin to meet with your providers on the changes that will be needed in documentation and start to hopefully revise any templates for your electronic. Determine how your patients will be educated on the types of information that you're going to be asking and what to do in the event of denials after 10/1. In spring of 2014, we suggest that you start sending any coders to actual ICD-10 training where they go to a one-day session on how to use the book. And no later than June of 2014, you start contacting your payers to determine readiness. Okay, we're going to go through just some of the changes of ICD-9 versus ICD-10 so you get an idea. ICD-9 has 3 to 5 characters. ICD-10 has 3 to 7. In ICD-9, there are 14,567 codes, and in ICD-10, there are almost 70,000. In ICD-9, the first digit was either alpha or numeric, and in ICD-10, the first digit will always be alpha. And in ICD-9, there was no specificity regarding left or right. And in ICD-10, they have added left and right to many areas of ICD-10, thus a lot of the new codes. So in ICD-10, 34,250 or 50% of all of the ICD-10 codes are related to the musculoskeletal system. 17,000 or 25% are related to fractures. About 10,500 or 62% distinguish right versus left. So for the addition of ICD-10 codes, they added 12,700 codes, which now tell you if it's on the right side, And on the left side, they've added 12,393 codes. So that actually constitutes 46% of the total increase in codes. But again, left and right is always going to have to be documented as part of the documentation so that it can be coded to that specificity. The injury and poisoning section, the codes increased to 39,869. 2,600 in ICD-9. Again, anatomic specificity increased to 6,339 in ICD-10 versus the 892 in ICD-9. Some of this comes from, we're going to talk about this, but some of this comes from the addition to breast cancer codes for both male and female. The fracture codes have also been expanded. You now have to determine and document whether if the visit was the initial encounter. That entails 13,900 plus codes. If it's subsequent encounter, that is 21,389 codes. If it's displaced, about 5,300 codes. Non-displaced, routine and delayed healing each have 2,913 codes each. Malunion and non-union, 2,895 codes each. So the fracture documentation, including aftercare visits, is going to have to be much more specific to so that we can code more specificity in this in the area of fractures. Code comparisons. Hypertension is a one-on-one match, 401.9 in ICD-10, or ICD-9, in ICD-10 it's I-10, one-on-one match. Depression is a one-on-one match. Right now it's 311. ICD-10 it's F32.9. So you can see there's no correlation here. So you can't even remotely compare the two. Urinary retention is a one-on-one, 788.20 versus R33.9. But you can now see that the late effect of a hemiplegia affecting the dominant side under ICD-9 was one code, 483.21, but in ICD-10, it's one of two codes based on left or right. Now, there are still non-specific codes in ICD-10, so if you don't specify left or right, there are still non-specific code assignments. However, we are told that it's possible, if not initially, later on down the road, that the FIs will not accept unspecified codes, because that was the whole reason for going to ICD-10 to begin with, was for more specificity. So they might allow some at the beginning, but as we get into ICD-10 more, it is our understanding that they'll probably start denying those. Okay, diabetes is a big change for those of you that code diabetes. Right now you have your diabetes code, which is your 250 point whatever, and then the complication code added onto that. In ICD-10, they lumped them all together. So you'll see that diabetes type 1 is codes E10 through E18.9, which is 40 codes. Diabetes type 2 is E11 through E11.9, which is 40 codes. They took the complications and combined it with the actual diabetes code, so you have one code instead of the two. They split out gait abnormality in ICD-10 to 3, which is falling, unsteadiness, and walking difficulty. So they've added those 3 codes and instead of gait abnormality. You will also see that in the ulcer, an example of this, ulcer of the heel is a 707.00, but again, left or right, 2 different codes. In ICD-9, we have a pressure ulcer, left heel stage 1, 2 codes. ICD-10, it is 1. Aftercare for hip replacement in ICD-9, again, is the 2 codes. ICD-10, you have 2 codes, but again, we have the aftercare for the hip replacement and then left or right or unspecified. But again, we have to really be careful about the unspecified codes. On stress incontinence, they combined them in ICD-10. In ICD-9, they were separate. ICD-10, they combined them. They added a code for chronic insomnia in ICD-10. And you'll see under breast cancer malignant, in ICD-9, we had 9 codes for the female and 2 for the male, and they've now expanded 27 for each. And what they've expanded is the actual anatomical site of the location of the cancer in the breast. So that's, again, going to be more specific documentation that's going to have to be recorded with regard to the specific site of the breast cancer. Encounters for therapeutic drug monitoring. Right now we have 2 codes, and then we have ICD-10. The 1 code, and then they expanded. For example, this example, they split out the long-term use of steroids into inhaled versus systemic. So in order to code long-term use of steroids in ICD-9 or ICD-10, you're going to have to document whether it was inhaled or systemic. We, with LUTS, we've partnered up with the NMA, and in early spring, we're going to provide 2 one-day ICD-10 basic training sessions, 1 in Omaha and 1 in Lincoln. We're going to determine the dates in the future. We are also looking at outstate Kearney, possibly, and these will just be 1 day, how to open your book in ICD-10 and assign the codes. And then the plan after that is to do specialty webinars, 1 hour over lunch, and go into specific OBGYN, ortho, family practice so that we can zone in on the different specialties. And you can contact Gina. We haven't determined the dates yet, but we're working on that, and she will be the contact person for that. And that concludes the formal presentation, so we'll entertain any questions that you might have.
Okay, we are now going to open up the lines to any questions, and if you would rather ask your question via chat or in the question box, you can type it in. And it looks like currently, Darcy, if you have a question, I'm going to open up your line. Darcy, your line is open.
I'm sorry, dear, I hit the wrong button.
Okay, thank you. We have a question from Brenda Bacon. Brenda, your line is open. Brenda, are you still with us? Okay. All right, I'm showing at present we have no questions in the chat box or the question box, and no one has their hand raised. So we will go ahead and conclude the webinar at this time. If you do have any follow-up questions, you're more than welcome to email them to me, which my email is listed on the screen in front of you, along with my phone number. I can direct those questions to Nancy directly to get back to you. If there is interest, we would also be happy in providing you a copy of the slides that were presented today. And again, if there are no more questions, then we will go ahead and close up the webinar. Thank you for your participation, and be looking for more news to come about the future webinars that we have coming, as well as the on-site programs. Nancy Smith, your hand is up. If you have a question, you'll have to enter your audio pin, but I have unmuted your line if you would like to ask your question. Okay, then we will go ahead and conclude the webinar. Thanks for tuning in. If you have any questions, let me know.